My name is Avisa, and I'm a physical education teacher at Government Higher Secondary School. Today I'll be talking on the topic first aid. Now, what is first aid? When we talk about first aid, what comes to your mind first? The equipments which we need during emergency time, like maybe of bandages, scissors, and so on. So let me just define what is first aid. First aid is the immediate assistance given to an injured person or sick person before the arrival of medical expert. That means anyone can be a first aider. Maybe you, maybe me, or any layman. So aims of first aid. There are 3 P's of first aid. First is preserve life, to preserve the life of the injured person, prevent further injury if someone is injured, to take care of that person so that there won't be any furthermore injuries. And lastly, to promote recovery. That means before the arrival of the medical doctors, to take care of the injured person. Now, basics of first aid. First is emergencies. The first aider, if someone is injured, it may be of minor, it may be of major injury, but it will be an emergency, so we need to take care of that. Second, we need to call the emergency number, maybe of 108, which is relevant in all the states. That is for medical ambulances, 108. And the next thing, a first aider should stay calm. He or she should never get panic when giving assistance to an injured person. Next, we need to check whether the scene is safe or not. Look around the surrounding, whether the scene is safe to take care of the injured person. Next, general condition of the patient. Check the general condition of the patient, whether he or she is seriously injured or not. Next, you need to check the pulse of the patient and check the respiration level of the injured person. Check the color of the tongue, lips, conjunctiva, that is eyes and nails. Check whether the color of the tongue is becoming pale or the lips. If the color of the lips and tongue is pale, that means there's a lack of oxygen. And if the nails turns white, it means that he or she is losing lots of blood. So you need to, a first aider should check those 4 things. That is tongue, lips, eyes, and nails. And first aid kits. A first aider should always keep with him or her all the basic necessary first aid kits. That may be of bandages, maybe of scissors, maybe of some aspirins, etc. Use PPE. PPE in the sense personal protective equipments, maybe of glove, maybe of mask. Stay with the victim. When you attend a injured person, never leave that injured person behind. Go in search of other person like that. Always try to stay with the victim and let's get the help through the phone or call out someone loudly. You can also follow this recognition, that is DRSAB. D stands for danger. Look at the injured person and look at the injured area, whether is it mild or is it major or is it very dangerous. Second, R stands for response. Talk to the injured person and see whether the injured person is replying back to you or not. Next, shout. You shout for help, maybe in the phone or maybe anyone near you, so that the other person may come and help you in giving the assistance to the injured person. A stands for airways. Look at the airways, whether it's having a free flow of air inside the injured person or not. And B stands for breathing. Check whether the injured person is breathing continuously or not. And while giving assistance to injured person, one should always remember this legal consideration. Every person has the right to refuse. Every person has the right to refuse, but in Nagaland, when we talk about in Nagaland, we are a good Samaritan. We have these principles of good Samaritan. So we automatically go and help if there's an injured person. But while doing so, you should always remember that there's a legal consideration. So you need to ask that injured person whether he wants you to help him or not. So every person has the right to refuse. If not, you can ask the parent or guardian should be asked before providing care to a child. In their absence of consent is legally applied. Now, tips for physical examination. When you examine an injured person, what are the things you need to keep in mind? First, explain what you're going to do, what you are doing. Explain to the injured person what you're going to do or what you are doing. Tell him or her that you are there to help him. Stay calm. Do no further harm. When you attend an injured person, try to be calm so that there is no further harm. Be thorough. When you attend an injured person, if you are a first aider, be thorough with the injured area or be thorough with the injuries. Compare body parts. You need to compare with the body parts. And next, one person does the examination. When you attend an injured person, don't leave the injured person on the spot. Rather, one person should examine the injured person and let one fellow record the finding so that when you go and give the report to the medical doctors, there will be a concrete finding. Next, sign and symptoms. There's a difference between the signs and symptoms. First, let us talk about sign. A sign is something that can be observed externally. Example, a heart rate, temperature, color, or moisture. Whereas a symptoms is felt internally. Example, nausea, dizziness, fatigue, pain, which is not visible in our naked eyes, for which we need to ask the injured person. Next, first aid treatment. When you go for first aid treatment, what are the things you need to do? First, PPE, personal protective equipment. Second, direct pressure. Elevate above the heart. Never remove bandage after it has been applied. That is never. Now, when we talk about PPE, these are the things. Blood-borne diseases are there. First, hepatitis B, hepatitis C, and AIDS, HIV, which can be spread through blood. So you should always use PPE, that is personal protective equipment, maybe of glove or maybe of mask, to prevent yourself as well as to take care of the injured person. Next, apply pressure. If there is a cut on the hand, direct apply pressure so that the blood flow can be stopped. Elevate. If there is a sprain on the leg, one should always remember to elevate the leg above the heart so that there's a lessen blood flow to the leg and the swelling will decrease. Now, first aid for mild wounds. In wounds, we have cuts, we have incisions, and first thing, what you need to know when there is wounds, for mild wounds, rinse under running water. Second, pat the wound dry using a gauze piece, maybe of any white cloth or any clean clothes. Cover the wound with sterile dressing, that is bandaging with clean clothes. If there's no bandages, you can use any clean cloth or any cotton like that. And the next, bandage the wound and seek medical advice. Always remember that you are a first aider, not a medical doctor. So you should take care of the scenario and then report to the medical doctors. Now, fainting. This is very common among the students and very common among the society. So let's talk about what are the causes of fainting. First, maybe of emotional shock. If someone is dead or if someone in the family panic like that, there is something which arises that is called fainting. And if there is pain, that can also cause fainting. If there is lack of food, if someone is having less intake of food for the previous day, there's a high chances of fainting. Or over exertion. If you over exercise, there's high chances of fainting. Dehydration also can cause fainting. If you are drinking very less of water, for a normal person, 2 to 3 liters minimum a day is a must. But if you are drinking less and if you are exposing yourself a lot to the sun, there's high chances of dehydration. Next, exhaustion. If you are getting tired, if you get tired easily, there's high chances of fainting. Sight of blood. Some people have the tendency of fainting when they see a small blood in one's own body and in others' body. So it has a high chances of fainting when you see the sight of blood. Standing upside suddenly. If you are sitting for an hour or maybe more, and if you stand up all of a sudden, there is a very high chances of fainting. Standing in hot condition. This is very common among the students. Standing in hot conditions. If you're standing in hot conditions for too long, there's very high chances of fainting. Now, first aid for fainting. If you feel faint, lie down or sit down. Place your knee between your knees. This is for the one person who is feeling that he or she is going to faint. If you feel that you're going to faint, lie down on the place itself or sit down. If you sit down, place your head between your knees and relax. This will ease you. Next, if someone faints, position the person on his or her back in inclined position, that is legs up. I'll be showing you the diagram. Maybe in this position. If someone faints, you have to let that person lie down in this position, inclined position, that is legs up. Maybe in any kind of chairs or whichever equipments you get, you place it between his or her legs and let the legs be placed in inclined position so that the blood flow will go back to the heart and and that person will have the high chances of getting recovered fast. Now let's talk about nosebleed. This is very common among the children. So what is nosebleed? Nosebleed can happen because of sudden punch or maybe of contextual games. It can cause nosebleed. So let's talk about nosebleed. How to prevent when someone have nosebleed. First, why you should not bend backward. See, we have the tendency of, if someone has the nosebleed, we have the tendency of letting that person bend backward. So it is a total no. You should never let that person bend backward. Why? The reason is that that person has the high chance of choking or maybe nausea and vomiting. Now, why vomiting again? If that person, if he or she bends backward, the blood automatically it goes back through your pipe, and then when it enters your stomach, that our blood has once smelly things which can cause that person to vomit or have nausea. So that person, if someone is bleeding, having nose bleeding, you should never let that person bend backward. Rather, you should let that person bend forward. And then when you bend forward, what are the things you need to keep in mind? Pinch the soft part of the nose. When you start from above, you go down slowly, and there's a soft part. You pinch it there and tilt the head slightly forward, like shown in the diagram. That is, which is ticked in green. So you should hold like this, not bend backward, rather bend forward, slightly bend forward, and hold it there. If the nosebleed happens, pinch the soft part of the nose and tilt the head slightly forward. Now, when to get medical help? Get medical help if that bleeding persists or continues more than 20 minutes. Next, if that person has had injury, never and ever being a first aider, try to take care of that person, rather get the medical help. Or if that person has blood-related disorder, try to get medical help and don't be a medical doctor by yourself if you are a first aider and not a medical practitioner. Now, first aid for sprain. If someone has sprain, and this is very common among the sports person and the school students, first aid that sprain, sorry. So what you need to know and what you need to do when someone has sprain. Try to follow these 4 principles. That is, rise. R stands for rest. I stands for ice. C stands for compression. And E stands for elevation. Now, rest. R stands for rest. What do you need to do? If someone is injured, let that person rest. Don't let that person continue with the same kind of activity. If he or she is playing, don't let that person continue. If you let that person continue, he or she has the high chances of getting more injured and causing more injury to that injured area. So you should let that person rest, lie down. Next, ice. Take an ice cube, cover with a cloth, and then put an icing on that injured area, that is sprain. And when you do icing, always remember to do only for 20 to 30 minutes. 20 to 30 minutes, not more than that. And if the injury is within 24 to 48 hours, you can do icing. Now, we have the tendency again here. In icing, instead of icing, we are very common in using hot water with salt. So you should never use hot water when in taking care of sprain. Rather, you should use ice. So if the injury is within 24 to 48 hours, try to use icing so that the swollen area can be compressed. Now, C stands for compression. Use ACE bandages. ACE bandages in the sense is stretchable bandage which can be stretched. And when you tie, try to tie from below till up to upside, not from up to down, but down to up. And the last, there is elevation. Let that person lie down and elevate the injured area. That is, if it is hand, raise it up. If it is leg, raise it up above the heart level. These are usually helpful in minimizing the damages. And the next thing, consult medical doctors to evaluate the injury. Thank you.